So welcome to another edition of the Cultivating Tradition podcast. This is a very interesting episode. I think many people might be considering a career in acupuncture or might be looking to graduate soon in their career, and they might be interested in what the reality of a practicing acupuncturist is and the importance of acupuncture in modern day healthcare. So I'm really happy to be joined by Colette today, who is a fellow of the British Acupuncture Council, had quite a wide and varied career. You just told me that you celebrated your 25th anniversary of practicing acupuncture. Right. And you're also on the Membership Services Committee of the BAcC. You've been a brilliant advocate for acupuncture over the years.
Thank you.
So
Thanks for having me.
My pleasure. And I think a great place to start is, how did you decide to become an acupuncturist, and how you decide where you're going to study, and maybe some of your experiences in the training phase of your career?
Okay, well, it was many moons ago. I originally did the regular university route, and after university I got a job, and I was in my early 20s, and I was really interested in natural medicine. So I trained as an aromatherapist, and at the time it wasn't like it is now. There were no short courses, and it was a proper course where I had to do a year. I studied anatomy and physiology. I became a member of a professional body. And so I started working as an aromatherapist. And I then decided I wanted to study a complete system of medicine. So I chose traditional Chinese medicine and embarked on an acupuncture course at my local college. Again, there were no short courses at the time. There were actually very few courses in the early 90s. So I was really lucky to find an amazing course which was very near where I lived. So I enrolled, and I've never looked back.
Which course was that?
It was at a college in Finchley, and it was a 3-year acupuncture course. And we studied anatomy, physiology, pathophysiology, which is the process of disease, and we did 3 years point location, and I also did a year in the student clinic. So it was a very intensive, comprehensive study of traditional Chinese medicine alongside Western medicine and Western medical sciences, and at the end there was a year in the student clinic. And I graduated in 1999.
I think a lot of people aren't aware of how in-depth an acupuncture course will be. It's got many of the constituents of a medical degree, with the, as you say, the Western science bit, as well as the deep traditional bit. And this college was accredited by the British Acupuncture Accreditation Board.
So that's absolutely right. And as soon as I graduated in 1999, I was a BAcC member. Yeah, and I was in my mid-20s at the time, so I've grown up as a BAcC member.
So you graduated from college, and since then you've worked in a number of different settings. I think people would be quite interested to hear what kind of things that you've been treating, what kind of settings have you worked in, and what are some of the main lessons you've taken away from that?
Yeah, so I was really lucky because I was already working in the field. I was able to integrate acupuncture into my practice, and it took off really well, and it evolved from there. And I had already had an established practice. I think in the beginning was working in the city and in Chelsea, and I was just able to grow my practice as an acupuncturist, which was amazing. And I think also the experience I got in the student clinic was absolutely invaluable. And I have always had a specialist focus in women's health. In particular hormonal health and reproductive health, and also stress. And that's stayed with me pretty much from being from the early 90s work right the way through now. It's evolved, but it's been something that I've always gravitated to. And I have also done some voluntary work. I'm a strong advocate of voluntary work. I think being an acupuncturist, there are so many different levels of study. And I think for me, doing voluntary work was really enriched my career as a practitioner, because you learn things that you would just never learn at college. So I highly recommend for people to do voluntary work wherever you are in your career. I did it around 15 years ago for quite a while in the mental health services, and the skills I learned then are still with me today.
So you've done a lot of work in mental health.
Yes, so I have been working alongside a very eminent psychologist, Mayor Stoliar, who is one of the lead psychologists at the Priory Healthcare. And he sends me his patients who have anxiety and depression. And we have found over the last 20 years that when you integrate acupuncture with therapy, it produces great results. So it's not like one versus the other, it's an integration.
Well, that's interesting. You've been a strong advocate for acupuncture as being part of an important program for general healthcare.
Yeah.
And you've written a number of blogs on the issue, and I'm just wondering if you could share some of your insights on that.
Yes, so I mean, I've been writing for years. I really like writing for the public. That's something I really enjoy doing. And my most recent article was written for IVF Babble, which is a leading fertility magazine. And it was written with Professor Tim Child, who is a leading fertility specialist and professor at Oxford University, and also, interestingly, a visiting professor in China at a university. And we discussed the integrated approach to healthcare and also the importance of choosing a qualified registered acupuncturist. So the integrated approach that we discuss is really a strategy which looks at the combination of acupuncture, diet, counselling, relationship health, to bring a more patient-centred approach to healthcare, and essentially can improve the wellbeing of patients and improve patient outcomes, potentially reduce side effects of medication. This is not just about fertility care, but it's also about cancer care or mental health or even menopause care. I mean, if we take the menopause, in menopause care, you have many women that take HRT now, which is great, but there are a small amount of women who, for example, cancer patients who are put into a medical menopause and end up taking tamoxifen. They have debilitating hot flushes, night sweats, really debilitating menopausal symptoms that disturb their quality of life. And there was a research study in 2019 of 70 people in Denmark over 6 weeks, which showed a significant reduction in menopausal hot flushes, night sweats, sleep problems. And they really advocate for acupuncture, that it was really positive at reducing symptoms.
I think this is a really important area to highlight as well, because one of the themes in your work and your blogs is that acupuncture being part of an overall integrated approach to healthcare, and so we don't have to say that acupuncture is going to be the whole part of the picture in every situation. In this picture, it's helping managing the side effects of this important medication. And I think you were talking about acupuncture being part of an overall program in mental health, for example, and its role alongside other forms of medication and other practitioners.
Yeah, so I think the way that our medicine has evolved is that we always used to be classified as alternative, like, oh, have acupuncture because that might be an alternative. And then it became a complement, so have acupuncture because it can complement treatment. And I think where we're at now, and I know the work that you're doing, and indeed where we are at now as a profession, is it's about integration and working together with Western medicine and doctors to improve, as I've said, patient care and patient outcomes, because ultimately the well-being of our patients is at the centre, the holistic approach.
100%, and I think that puts the British Acupuncture Council members in an interesting place,
Yeah.
because the standards, and going right back to your training, that standard of training that we have, it's not just training us in the deep tradition that we have to actually become really effective practitioners and harness the whole power of a 2,000-year-old literate medicine, but it's also training us to become trusted healthcare practitioners that can work as part of multidisciplinary teams and interact in a really fruitful way with conventional medicine going forward. So I just wonder what your experience of being a BAcC member is and what you most value about it. Yeah.
Okay, good question. Well, firstly, I've been a BAcC member I celebrated 25 years, and so I'm in my 26th year of practice. And for me, the way I would see it, firstly, is that the BAcC have been advocating for the profession for 30 years. So it's strong, it's trustworthy, it's reliable, and it's experienced. And I think that's really important when we're advocating for a profession and for integrating healthcare, that all of that is achieved. Secondly, we are on the PSA register. So for those people that don't know what the register is, should I explain?
Yeah, so the Professional Standards Authority for Health and Social Care accredited register, which gives a gold standard of recommendation of our standards, the standards we hold in professional practice, in safe practice, and all of those things that go into making us a trusted healthcare practitioner, that when someone seeks a practitioner or our practitioner database, they are finding somebody who can be trusted effectively.
Absolutely. And I think that from that, we're listed on the NHS website, and we're also listed on the HFEA fertility regulator website.
Yeah.
And we are also part of the GP referral scheme. So that's quite a lot of benefits. And we have very high educational standards, and we have the codes of conduct, ethics and safety, and support in all those areas. And also we have a wonderful staff team now, and I'm really excited about that. And we have a great new comms team, which I'm really excited about. And we have community.
Yeah.
So there's, for me, in every step of my career, I've always been a member.
I think that when you look around at the caliber of the members, many people have been practicing, as you say, for 25 years. All that experience. Many people have come in second careers. They've practiced all sorts of other disciplines first, so that the depth of their knowledge about the world as well as the practice is unmatched, really. And particularly our community are all the people who have the strong values to inform their decision to take the rigorous training to begin with. So these are the people that comprise our community, and they are amazing, wonderful community. So just one final question. You were talking about your career and how you trained. But I know that you've been thinking a lot about where you want the medicine to go in the future. Our conference theme this year is Cycles of Life. So we've all been thinking about what phase are we in acupuncture, in the British Acupuncture Council. Where can we see it going in the future? What would be part of your ideal vision?
So, firstly, I would really like to see our profession accepted for the quality and the standards of practice that we have. So I'd like to see us regulated. There is a disparity at the moment. Anyone can call themselves an acupuncturist with 2 days training, which is another reason why I wrote the article with Professor Child, is that he's also an advocate for since you've had the post-COVID wellness boom, pretty much anyone can, with 2 days training, become an acupuncturist or anything. You can become an expert in anything very quickly now. And it's really important for the public to have accredited registers and to have qualified practitioners. And I would like to see us the title acupuncture protected and to see us valued for who we are as practitioners. So I'd like to see that in my lifetime, which is why I help at the BAcC and try and advocate for that to happen. I'd also really like to see us integrated into the healthcare system. So, for example, at the moment, again, post-COVID, there is a mental health crisis. We have 1 in 5 now on antidepressants or trying to come off antidepressants. Now, I'm not advocating for a minute that people stop taking pills, because some people do need to take medication, there's no question. However, there is a place for a patient-centred holistic approach. You know, the mind-body connection is a thing, it's real. And I think we can integrate privately into healthcare and also into the NHS. And I think that that's what I would like to see.
I think that the whole profession has come to a point of maturity. So the caliber of the practitioners, standards we hold, but also acupuncture is widely accepted now. We know that it's going to form part of the future of healthcare. And so I completely agree with you that that should be matched with support from institutions, from the government, from the NHS, to uphold those standards so that when people are seeking it, because everybody is seeking it, they'll be able to find people with the skill to treat them, but also the trusted healthcare status so they can be a good healthcare practitioner that works professionally.
Yeah, I mean, I think I also would like to say that I find in the complementary therapy arena, if you like, there is no regulation. And I think we're almost starting to get regulation by being self-regulated. And I think that I'd really like to see, not just with acupuncture, but across the board, regulation.
So thank you for coming, Colette.
Thank you very much for having me.
It's been a really important edition of the podcast where I think people can really hear the reality of what it's like to work as an acupuncturist and the importance of acupuncture going forward, not just for treating people, but also as a part of an overall strategy for healthcare in the UK. So I hope that you enjoyed this edition of the podcast. We'll have plenty more coming up, and I hope to see you at the next one.